Hello, good morning, everyone. So, yeah,
Good morning.
let me introduce quickly about Vata and why we are doing, and then I'll introduce our amazing speaker today, Dr. Meeta Garu. So, yeah, Vata is a Washington Telangana organization which started in 2013 by Vamshi Reddy and his friends, and it is doing amazing community service over the years. And we do Batkama as our biggest festival and Women's Day celebrations and lot of food drives. And we also do Adopt a Village program in India and Adopt a Road services here in the US, in Washington, and lot of other community services we do to help and bring all the community together. And now this session is part of women's event. So this year we started and focusing on women related events, and this is part of it. And many of us have questions. Okay, what is perimenopause and menopause? And this is a very sensitive topic among us, and we also not discussed openly, and we all have very many questions and don't know how to where to reach and how to get the answers. So yeah, so to answer all our questions, so here we have the amazing speaker, Dr. Meeta Garu. She is a head gynecologist, specialist menopause and osteoporosis, co-director in Tanveer Hospital, founder, chair, Indian Menopause Society Registry, and past president in Indian Menopause Society to 2012, founder, patron, Hyderabad Menopause Society, chair, clinical practice guidelines on menopause and postmenopausal osteoporosis. And she also has awards, Editor General of Midlife Health, MD with areas of interest, obesity, menopause, postmenopause, PCOS, gynecologist, ultrasonography. So we are really honored to have you here, Dr. Meeta Garu. It's amazing to see your profile, and this is perfect. We all have so many questions, and this is going to be the exciting and amazing session for us. Pl-
A very good morning for you people. And, from my side, it's almost night over here. It's 10 p.m. And thank you so much, Sangeeta, for connecting with me. It's a topic which is very close to my heart. And I'd love to speak on this. And if it helps even a few people, the time is it's worth the time that I spend. And amazing. So, congratulations on the amazing work that your association is doing. So I knew in my heart that though I'm addressing now the NRIs, but I knew that you are all Indian at heart, and so I have kind of made this presentation keeping that in mind. And you are so I start off with my presentation where menopause is something like a radiant Indian summer, not like your Boston and Washington's cold winters. So that means there is something to look forward to. We had a slogan contest recently, and one young 30-year-old, she came out with this beautiful slogan. So throughout your life, you are under the clouds. But when it comes to menopause, you're entering that phase. Actually, you are the sun. So it has a lot of meaning. That means a woman throughout her life is a shadow of everybody. You are giving so much to everyone, but when it comes at this stage of your life, yes, there are responsibilities, but still there is lots that you can do. So it all depends on how you look at yourself, and so self is important. That's what I mean to say. So menopause is actually not a pathology, and it is a normal developmental experience. So nature guides best when guided, and you can always stop me whenever you feel that we need to cut short or you need to stop it. Am I audible and is my screen visible?
Yes, we can hear you and we can see the
Great.
presentation.
Great. So today we're going to speak. discuss a little bit about what is menopause and how you're going to manage this stage of life. So we know all the transitions in a woman's life at any stage. It's all about hormones. So there are three kinds of hormones in the body that all of you, I'm sure, are aware of it. It's not just the estrogen and progesterone, but testosterone also has a very important role to play. So these are the three major ones that, make you, and it is a very important part of a woman's life. And so what happens is as you age, so your 30s and 40s is where the levels of estrogen are at its peak. And that's what you're seeing over here, the pink color. And after 40, your estrogen starts declining. And it is, of course, at the lowest when you're coming down to 80. So, whatever you had heard about hormone therapy over a period of time, actually, the WHI data, if you people are aware, it was all given in the population of 60 and 70 and 80, where the requirement of the hormones is very less. You see the dark color, dark pink color,
Yeah.
the amount of estrogen in the body is much lesser compared to what the color in the 35, 30, 35, 40, there the need is more. At 50, it comes down to half, and then, the quarter, then even less and even less. So what happens if you're giving excess of estrogen, then that is what the results did at that time. And so everything backfired, and what was going on well, suddenly the last 15 years, especially in America, all the doctors and everybody stopped prescribing, the women stopped taking hormone therapy, because of this wrong population and some of the wrong combinations that were selected at the time. So now, menopause, how do you know it? So that was the question I think Sangeeta asked in the beginning. So it affects, of course, every woman. No, nobody is exempt from it. And it is, when you call menopause, it's a retrospective. That means it cannot be diagnosed at a particular point of time. It can be diagnosed only when you don't have your periods for the past 12 months. Say you have irregular cycles once in 3 months, once in 4 months, but you have to wait unless and until you don't have periods for 12 months, then you say you have really attained menopause. Otherwise, those are the years where suddenly you can have irregular cycles and they can become regular for some people. And then it can go on like that. So in India, the average age that a woman can enter into menopause is around 44 to 51. Whereas in the Caucasian group, the Americans, it's the average age is 52 and they can go on up to 56, 57 as well. So we have different types of menopause, the one is which is natural, which happens naturally. Early is between 40 and 45 in India. Less than 40, we call premature. So these two are we consider them as disease, as pathology. Menopause, we consider natural menopause as a natural happening. Whereas if a menopause happens less than 45, that is not normal. That means they need more attention compared to what a woman who's entered after 45. And it can be surgical or medical. So once the estrogen levels actually starts fluctuating after 35 to 40, and then all these symptoms start appearing, and this is a very beautiful slide where everything is put together. So finally, whatever is happening, what really happens is quality of life. That means all the changes that are affecting you during this period will actually have a change in your day-to-day quality of life. And I think quality of life is what is really important. Now, some people can have mood swings. You just forget things, you keep things here, and then you just don't remember what you have done with them. And some people can start having a little difficulty in sleep or irritability, little anxious. You're not able to control your thoughts, or you're not able to perform as good as you were doing earlier. And of course, Vasubota symptoms, that is, the hot flushes, are the hallmark of the falling estrogen levels. So that is the only symptom which is 100% related to the declining estrogens. All other symptoms can happen due to so many other reasons. It need not necessarily be estrogens. And so many things are happening as you're aging. It's not just the estrogens, no? All your other hormones in the body, be it your pancreas, be it your thyroid, be it your cortisol. So all of them are also undergoing the aging changes as in your body. So all of them are going to act together And that is how everybody presents differently. In the post-menopause, you have a different set of problems because of the declining estrogen. So what you can experience in the early part of your menopause, that is, so we call perimenopause the period before you stop your periods. That is, it may last from 2 years to 6 years and sometimes 8 years. So that means if your menopause in India is 47, the symptoms can start off as early as 40 years. And for some people, it can be just 1 or 2 years. So it's different for different people. So the classic symptoms are the hot flushes, the sleep disturbance, the excessive sweating, tiredness, body pains, mood swings, forgetfulness, dry skin, and hair and weight gain. Weight gain, I think, is it bothersome for people. Melasma. And later on, as you enter into menopause, the vaginal problems also start coming in. So they can be dyspareunia. Dyspareunia is painful intercourse. But the recurrent infections and the vaginal dryness is usually a little later. So these are the symptoms which come in. But most importantly, what can happen is, apart from the vasomotor symptoms, people can start having irregular cycles. And I see a lot of Indian women come to us with body pains. They come to us with irregular cycles with no pathology in the uterus. So that really bothers them. So it has now become very important. So the simple way that you can follow up is by using this menopause rating scale. It's available online for all of you. So before you go to your doctor, before you go to see somebody, it's always good to, download this and fill up the form. Very, very simple. You just score it none, mild, moderate, severe, very severe. So that means none is you don't have, mild is once in a way you get any of the symptoms and it really doesn't bother you. Moderate is, yes, you are feeling that something is going on, but it's not affecting your life. But severe and very severe are those where you cannot function. So that's how you grade them. And so the symptoms of menopause are dependent on what you are going through. So it's unique. It's not a blanket one for everybody. And who needs treatment, who doesn't need treatment, we rely heavily on this scale because we know what is affecting your quality of life. So the scale is very important, and this is what you have to do. Now, there is a lot of good information which is coming in, which says that if somebody is suffering from vasomotor symptoms, it's not just that it's going to be there for 2 years, 4 years, and maybe, extending beyond postmenopause. And some people, it goes on for 5 years, 10 years. Those are rare. About out of 100 people, maybe about 5 or 6 people, it can go on like that. But they say the the women who suffer from vasomotor symptoms are more prone for cardiac diseases, especially if you have a genetic predisposition. Then if you also have vasomotor symptoms, it's always good to be on guard and get your cardiac evaluation done and your bone health done. So it means that, the estrogen receptors in your body everywhere are being affected. Yeah. Any question in between, or shall I continue?
Please continue, doctor.
Yeah. So apart from that, the problems that we find, like I said, the estrogen affects every single cell of your body. The decline affects every organ of your body. So the adipose tissue, there is a change from the gynecoid to the android form. So the gynecoid is the woman form, no? The hips are broader, the waist is narrower. So when you say an android type, the fat is centering into your abdominal cavity inside your viscera. So there the fat goes and sits into your pancreas, sits into the ovaries and, the liver. So then the adiposity there is metabolically active, and that leads to the metabolic diseases, that is the NASH, the NAFLD, and also the diabetes. Everything can precipitate. So people who are more prone for these problems, all of them precipitate as you're aging and at menopause. So it's not really directly related to menopause, but if you are genetically programmed and if your lifestyle is bad and you're at a high risk for any of these disorders, menopause, estrogen deficiency can add as an extra risk factor and can precipitate all of them. Yes, it can also accelerate the loss of your muscle. And that starts off right from 30, your bone loss and your muscle loss. Just your peak is there at 30, 35, maximum to 40. After that, if you don't do anything active, and if you're very complacent, then your muscle, as your bone mass, starts falling down with aging, and the acceleration is much more immediately post-menopause. That is the first 6 years, the decline in the bone mass, the decline in the sarcopenia can happen quite a bit. So with this ectopic fat, like we said, it's not just in the abdominal cavity, but adipose tissue, not related to estrogen as such, can cause a lot of other problems. So even cancer. So we'll come to it later. Now, there can be accelerated loss of cartilage. That means the collagen loss is there, and that's why we're going to have the dry skin, isn't it? So it can precipitate osteoarthritis for some people, but estrogen is not the cause of causing osteoarthritis. Remember that. None of the NCDs are caused by estrogen loss, but they are precipitated and may act as an additional factor. So none of the major non-communicable diseases are treated by estrogen alone. So don't have that. Estrogen is not a treatment for everything. But yes, when estrogen declines, your testosterone to estrogen ratio changes. So what happens is you start developing the hair on the chin, like I've shown you over here, and there is frontal balding. So these are the things, the body changes which happen, the image changes. So this is a beautiful painting, which depicts how a woman can carry the pot in different ways. And that's exactly what happens with your menopause. You carry your menopausal experience. Every person actually carries it as distinctively as a personal fingerprint. And this is what I have put it in our clinical practice guidelines. I'm the chief author for that book as well as the executive summary. And because everybody's experience is different. And so you react to it differently. That is why everybody's experience cannot be same and there cannot be a blanket treatment over here. So the effect of menopause varies differently. But luckily, in India, we as a professional, I feel we're quite blessed, because the women over here don't consider as the loss of youth. In fact, there is a status in society. They're quite happy without the periods. And if they don't have any problems, genetically, they are healthy, they have a good lifestyle. So the menopause just doesn't affect them. They're really, happy without any hormones. But everything, so, and your mental state, how you look at menopause, whether you're looking at it as a disease or you're looking at it as loss of femininity, then things change. Yeah, because some people can be very worried, some people can be very happy with a little wrinkles, with little white hair. It doesn't matter as long as you carry it with your grace. So it all depends on how you look at it. So menopause is an ancient, evolving biological and social phenomena, and it is seen. I don't know whether you people are aware that it doesn't happen in the animals. It's there only in humans and in whales and primates like chimpanzees and gorillas. So and some others, but very very few. So, but the whales and humans are the ones where it happens. For all others, the reproduction and the death happens almost the same. So there is nothing beyond that. The reasons are varied, but we have to learn. So it's a very interesting history, which I'm not going to go to, but you have to learn from the whales because the whales have a menopause period apart from the reproductive period because they mother the whales, they mother the small children around them. So there is a family cohesion, and that support is what the probably the whales live for to protect their progeny. So this is something that we have to learn from. So the Bell's theory, here I'll go into the Bell's theory as to how we have to actually approach menopause. The way that you approach menopause depends upon your environment, the way you have been brought up, the way you have been thinking about it. So that's important. So your environment is important. You yourself, from your childhood, what is your psychology? Are you an anxious person? Are you a bold person? Or whatever. So, all of that is going to play. Then little bit is the hormones. So basically, it is you yourself and your environment which is going to have a change in, which is going to affect the menopause experience. So very interestingly, menopause was considered as Rajuni Vatri, and this was, even in our Vedas. So it's not new to Indian culture. And they have always given, the woman has always been given a good status in Hindu mythology. So the Indian perceptions are actually is a powerful transition, and the women feel more empowered rather than a decline or loss. Because I think we as a culture, we accept, we have a lot of faith, we believe in faith, we are not driven by science alone. So we have faith, we are spiritual. So that I think really helps a lot. Whereas medicalization of menopause is what is happening now. It's good to some extent, but not so good, because sometimes, when you start considering this as an estrogen deficiency disease, then you're not going, so only 10% of the women probably would need therapy, but then probably more numbers would start happening it, because especially in the US, the last one or 2 years, there has been a huge change in the government's attitude towards hormone therapy and menopause. So global context, they're worried because over 1 billion women worldwide will be menopausal by 2025. So one of the things that they have done, the NIH of the US, they have started, coming out with huge research projects that is called MAPS. Like you said, we don't know what are the symptoms that are causing. Is it only menopause? Is it aging? Or is it any disease? So these are the questions which are going to be really answered scientifically by this particular group from the NIH, where they have a list of questions, the same ones that Sangeeta that you have shared with me. So probably we're going to get answers, but even before that, we know that there are symptoms. The only symptom right now related is vasomotor. All of them can happen due to any other reason. So, but then the red alert should always be there. So Indians, age average age is 47. All the diseases happen 10 years earlier than in the West. There is a high burden of all the diseases like your CVD, diabetes. Now, breast cancer is really reaching a high proportion, cervical cancer. But our strengths is our traditional mindset, our culture, our close family ties, our diet. Like you said, you do the batkama, you do the things together. So when you're together, it really helps to go through any transition. Transition is always challenging, anywhere. So your diet, your lifestyle, your faith, the spiritualism, and we accept it as a natural part of life. We don't question it. We consider it as a God's will, and there is a paper on it. And this cultural transition, but unfortunately, the transition is happening even in India. It's not just happening in the urban India, but also in the rural India, where the children are leaving the parents, and the parents don't want to come to the cities. So we have to gear up for that. We cannot turn a blind eye to what's happening around us. But to put it all simply together, the mantra for good menopausal health, that is called the Indian mantra for good menopausal health, is a holistic approach. That means you cherish your life, you cherish every minute of your life. You mind your food, what you eat, you mind your body. That means you have to pay attention to yourself. Nobody else is going to do it for you. You have to take care of your body, you have to take care of your mind. It's what you think, it's what you want to do. Mind your sleep. So, of course, I mean, I'm not going to go into the details. I'm sure you would have read so much about it. No gadgets before bedtime. And that's one of the most important things that we need to do. Mind your emotions. So you have to have a positive mind. There is no human being who doesn't have challenges or who doesn't have problems in their life, but it's how you approach it. And finally,
I
live without expectation. I think that's a very powerful statement. Do what you feel like, but live without expectation. So these are the ones mantras that we at Indian Menopause Society, this we have put forward. When I was the president in 2012, these were the posters we had floated all over India to all our gynecologist friends and colleagues to promote this concept rather than only hormone therapy. And the slogan that I had, put in at that year was fit at 40, strong at 60, and independent at 80. So life course is something that we have drawn, something like your ikigai, where you start off like a speck in the womb and you have to go back to the tomb. So you travel all over, but then you're going back there. So for us, if you accept this life course, life is much more simpler. You don't have to make it complicated. So over a period of time, you go through life with all the responsibility, with the wisdom, with the liberation, and when the time comes, you depart with happiness. So this is the acceptance that we have over here. So take menopause like a peaceful transition rather than a turbulent transition. So there's going to be a lot of social media now who consider menopause, premenopause as something, a disease, something that is terrible that's going to happen to you. Nothing like that. It all depends. If 10 people, 10% of the women do suffer. We can't deny it. But that's when they have to go to the doctor, that's they have to go to the professional and take help. So medical intervention definitely is needed. But when they have these symptoms at the 40s, at the 50s or 60s, and that is where the medication is required. But for everybody, there is something that we need to do, and I'll come to it in the next few slides. So in India, these are the challenges which I'm not going to talk about. So there are solutions. The most important solution is running of a menopause clinics. Unfortunately, globally, we don't have the system of menopausal clinics. They are not as, in place as the antenatal clinics or the infertility clinics or the IVF clinics, the gynec clinics, the fibroids, and all of that. But we don't have menopause clinics across the world. It's the same issue. Probably in the next 10 years, you're going to have more of them, and the problem is not different over here. So when you're looking at menopause, we don't look only at the symptoms. The symptoms are just one part of it. There are a lot of people who don't have symptoms, but definitely, even if you don't have symptoms, it is a checkpoint for your organ system that you're going to look at. So we need to integrate all this screening at this time, and hormone therapy is just as a part of it, but it can be not only for treatment of symptoms, but we also probably will look at it for prevention strategy for some women who are prone for heart disease or prone for bone health. But this can be done only by the specialist and not by the general practitioner as well. So it needs a menopause specialist and not a general gynecologist, because they have to understand your need. So not everybody can prescribe hormone therapy. And, before I forget, in America, there is something called compounded hormones. Please never go to those compounded hormones, because it's better to go to a doctor and have the prescription hormones rather than the compounded hormones, because the amount of the estrogen in that is not standardized. That is one. And all the salivary tests and all that you have for your FSH are all not to be done. And actually, there is no need to conduct any test to diagnose menopause. Do we conduct any tests to diagnose menarche? No, isn't it? So similarly, you don't need to conduct any test to diagnose menopause unless it is happening early, unless it is premature, or even at 45, you're looking to have a baby. So, there are certain situations where you're undergoing the blood test. So there is, or you're on therapy, you're on hormone therapy, and, certain situations where the doctor knows where they have to do your FSH, estradiol, inhibin, and all of that. Generally, you don't need any test. And let me also tell you that most of the chronic diseases are preventable. 80% of them are preventable. And that is where you need to have a lifestyle management. So we look at menopause, not just menopause or the perimenopause. We combine it with aging. So if you're symptomatic, we look at you differently. Even if you're asymptomatic, preventive health is important. So then we start doing a risk assessment for different diseases, depending upon your history, your health profile. And I told you the menopause rating scale is very, very important. They're very, very simple tools that we use, which don't cost anything. They're all kept on the table. And we do this risk assessment, and then we find your risk for breast cancer, for your cardiac problem, for your bone problem, your muscle health, all of that, we put it together and we label it as a risk status for you. And then we have this management plan, put it very simply. And I'm not going to go into the details because that's mainly for the doctors. So the guidelines from Indian Menopause Society, we have upgraded now this year to 2026. But generally what we say at menopause, you consume at least, half a liter of milk in any form. That is the best way of getting your calcium. But if you're a vegan and if you don't want to take your milk or in any form, there are so many other methods in which you can get your calcium. That's not the only way, but that's the easiest, because you take one glass of milk and your 3/4 of your calcium requirement is done. And support it with a lot of vitamin C, protein, 1 gram per kg, less than 3 cups, small cups, not the American cups, the small cups of your caffeine. Daily salt intake should be less than 1 teaspoon per day. Your oil, 2 tablespoons. And of course, you have to be careful on the medications and the so many supplements that are there. So the best thing to do is snack on your nuts and, sprinkle with your seeds. Foods rich in phytoestrogens include lentils, kidney beans, all. Bengal gram is excellent. So we think about soya bean only when you're looking at phytoestrogens. No, but these have so much of phytoestrogens, the lentils, the kidney beans, and the Bengal gram. So India is rich in a lot of things. So this is a simple method how you can calculate. I said if you take 1 glass of milk or 1 katori of curd, you're getting your 300 milligrams. And normally you get your if you have a nutritious diet, you get another 300 mg. So that means 600 milligrams of calcium is done. You don't need a supplement. So that's how it's very, very important. So just a simple measure can cause a huge impact in bone health if everybody understands it. Now we have a lot of people coming and saying, "Oh, I'm so busy from morning till evening. I'm just, on the move," and but that doesn't work as you're aging. As you're aging, physical activity is different, exercise is different. And as you understand, exercise can be of different types. So it can be cardio, which is good for your heart and lungs. The respiratory, so all the breathing exercises that are taught in yoga, good for your lungs again. Your movements in yoga are very important for your, the joints. But muscle strength is something different. That is the resistance. Kegel, never forget the Kegels exercises, which are important for your pelvis. And the most important is your brain. So don't say anything, use it or lose it, is what we say. So the brain also has to be kept active all the time, apart from your physical health. So this is a sleep hygiene. Be a learner. That helps in your mental well-being. All the time, read, converse. Very, very important. Don't do it alone. Always have friends. Always be a social person. So these are the pillars to prevent dementia. But of course, the genetic predisposition is always there. But to some extent, prevention can be done. So growing old is natural, but feeling old is not. And moreover, I think God should grant us the serenity to accept the changes that are happening and accept what cannot be changed with the, and you should be also having the wisdom to know the difference, and that's the bottom line. So osteoporosis looks like this. On to your left, where above the normal bone that I have written, the bone is so nicely, it frames you and it supports you. But the osteoporotic bone inside, the connectivities are lost, and that's why you start having the microfracture, and very easily you break bones in the 60s and 70s. And they're asymptomatic. You won't even know that the bone is getting weak inside because they don't have any symptom. No body pains, nothing. Usually if somebody has body pains and muscles pain, they are usually vitamin D deficiency or some micronutrient deficiency or so many other reasons that we have. So the DEXA is the one which gives you for the bone health. And DEXA not only gives you the bone health, this is what I use in my hospital, the DEXA machine. It also gives you the fat health and muscle health. So it's not just bone that you derive at from your DEXA. There are so many other things, information that you get from your DEXA, that is called the body composition. So in India, the indications for DEXA are very different from the American group, the US FD, which the indications, they start 65 years. But for us, the age when we had made this guidelines, the average age a woman could live up to was 65, 68. Now it has jumped to 70 plus. So there is no point in starting screening at that time. So we start screening 5 years post menopause, and there are so many other reasons why you should be going for your this thing. So I've already spoken about the diet-induced obesity, which leads to all your, and estrogen precipitates this at this particular time, leading to your heart problems, pancreas, kidney, anywhere. So the NASH, which people are talking about, the progression is very beautifully presented in this slide. So I just added this in for you all. How a normal liver with obesity, so non-alcoholic cirrhosis now is becoming very, very prominent, simply because of the rise in obesity, rise in the alcohol use, causing all of these problems, ending up in cirrhosis and cancers of the liver. Now, cardiovascular disease is number one killer, but unfortunately, women don't go to the hospital because there are a lot of atypical symptoms. They may just present as fatigue. They may not really present with the pain in the chest or going up to the jaw or to the left arm. They may just have persistent fatigue, and they may not be really feeling well. Sometimes the angio also doesn't really show up. This is called a microvascular disease. So, and definitely estrogen is involved over here. That is why the heart attacks, the cardiac problems are post-menopause, unlike premenopausal. So the women develop cardiac problems later in life. But there are a lot of, green signal, red flags that we have to look at. If you are a hypertensive, if you have had a pregnancy-induced hypertension during your pregnancy, and if you're obese, and if you've got a genetic predisposition, then you have to be very careful. You have to have a thorough checkup. So life 6 essentials are important. But the problem is it's as simple as swallowing a pill. It takes a lot of hard work. The discipline takes a lot of hard work. Lifestyle changes are free, but medicine is what people buy. So don't ignore what you have to do. So cancer, again, lot of modifiable factors, viral infections like HPV, Heliobacter, the pylori, H. pylori can be simply treated by medicines and you can prevent cancer. HPV is very, very important. The screening is important. The vaccination is important to prevent cervical cancer. Just taking the hepatitis B will prevent liver cancer. So you see your diet, your tackling your obesity, all these are modified factors. And that is the reason why cancers are also on the rise because of the growing obesity. Breast cancer is also to a great extent, almost 70% breast cancer can be avoidable. It's only about 30% where it can probably because of your genes, and that cannot be changed. So we strongly believe in immunization. I know there is a huge lobby against immunization, but we strongly believe that immunization can prevent cancers. And I mean, unimaginable 30 years ago. But there are two, the hepatitis B and HPV are two immunizations which can prevent cancer. And of course, the rest of them are dependent upon where you stay and what is the policy of the government and the professionals over there. So there's a huge boom. The minute the HRT came down, there was a huge boom in the nutraceutical industry. But we are paying so much and they are not always safe. Excess of vitamins is equally bad. So whether it's the Indian Menopause Society, North American Menopause Society, International Menopause Society, everybody agrees that in early menopause, premature menopause, menopause with symptoms, menopause with bone problems, at risk for cardiovascular disease, you definitely need hormone therapy. So these are the three most important areas where you need hormones. You don't want to become bent like that. You don't want to have fractures. You don't want to have problems in your sexual life. You don't want to end up with urinary tract infections. That is where you need the hormone therapy. So it prevents bone loss, and it helps in menopausal symptoms. It improves your quality of life. Whether it is the east or the west, woman can age well with a good quality of life. So this is one of my favorite picture of this, old lady hoisting the flag with the help of her husband and on the Independence Day. So it's a beautiful picture. I'm always so impressed with this. So breast, people are scared about hormones when it comes to the breast. But look at this very, very carefully. This is the data from the UK, the British Menopause Society. What they have said is if your BMI is more than 30, there are 24 times more chances of having a breast cancer. It is also more when there is no HRT, the baseline is 23. So it's 24 with additional number of cancers if you're obese. But if you're taking estrogen only therapy, it is less, that is especially the Premarin. The -4 means there are 4 less cancers if you're on estrogen alone therapy. But if you're taking an estrogen plus a medroxyprogesterone, the increase is 1 per 1,000 women. But if you're exercising, again, it is -7. So can you imagine what your lifestyle can do even in terms of breast cancer? And these are all evidence-based. So that is very important. So your smoking, your alcohol also would add to the breast cancer risk. So the type of estrogens that we give is, like we said, we don't give the testosterone, but we give estrogen and the progesterone. So if you have a uterus, only then you need the progesterone. Otherwise, it's only the estrogen. You can give the estrogen different forms, oral and transdermal. Of course, now transdermal is coming a big, big way all over amongst all the societies because a lot of evidence is building up. But we still feel that, the oral also has its own place. And I'm not going to go into the details where it is and where and why, but we can safely say if a woman is healthy and if she doesn't have any problems, it's a choice. Because if you take oral, it's very simple. You swallow a pill and that's done. But if you have to go for transdermal, in India, the patches don't do well. If you have a patch, it's comfortable because you put on the patch and it goes on for some time. But if you're using a gel after a bath, you apply it, you sit for 2 minutes till it is dry, whether it is a spray. So the compliance is slightly lesser compared to the oral. It's a little more cumbersome. So anyway, hormone therapy is good either ways for people who need it. It's actually the decision has to be taken or guided by your professional as to what you will need, whether it is oral or a transdermal or a vaginal. Now, I'm very happy to share that our guidelines featured among the top 5. And in fact, we were a little ahead of the North American Menopause Society as well, amongst the 5 guidelines in this particular paper of 2024. So the vision is in India to have menopausal clinics run this way with a lot of public forums. And so I end with this note, appreciate what you have, since you don't know what you've got until it's taken away from you. And that too when it's too late. So I'm not going to read what is there. I'll leave it there for you all to read. It's really heartbreaking image. And, so we pray and we hope that the war ends and all the people involved are safe. So thank you very much for your patient hearing.
Thank you. Thank you for this incredible knowledge sharing with us, Doctor. It's like we all now know what is perimenopause and what symptoms we now look for and what symptoms considered to be the menopause and when to reach out to the doctor. And we have couple questions shared with us so you mentioned HRT, right? So what are the some of the side effects with HRT?
Yeah, just like, if you have taken your OCPs, the oral contraceptive pills earlier in your life, whenever, for some, not everybody has the side effects. But some people, when they take the OCPs, you have a little breast tenderness to start with, which may take some time to go off, but generally it goes off. Some people can have headache, they can have a little nausea. These are small things which are taken care of. And it generally moves away with time. So they're not. But I think the most important side effect that people have with hormone therapy, if you're in menopause, is the bleeding that they have. So because, after menopause, your mind is not ready to accept the bleeding that happens. So that is what the professional has to guide you, the kind of bleeding that you have, and, when to report, when you have to get worried. But generally, any hormone therapy over a period of time, the bleeding stops and is never heavy. And it's usually scheduled bleeding. So those are some people are not very comfortable with having the bleeding with the hormone therapy. The other side effects which we are really worried about is the clots. That is a real side effect, but that's also there with the OCP. So, in fact, it is lesser with the hormone therapy when you compare with the OCPs. Having said that, the age factor is there. And if you're a diabetic, if you've got other problems, that is where we go for a transdermal and not give the oral therapy when we feel that you're at a risk for the clots. Heart disease, in fact, if you don't have a heart disease, if you're healthy, it's going to help you. It's going to be like a prevention, maybe. But if you already have a heart disease, then you have to think twice. It
Okay.
can precipitate some problems for some people. Bone health, anytime it is prevention and treatment. Strongly believe in that.
That's good to know. And we have one more question how to prevent or slow down muscle loss?
Muscle loss, yeah, no shortcuts. You must start right from your 30s and 40s, but it's never too late. So there are some, so I don't want to, discourage you. Even in 80s and 90s, you start doing your resistance exercises. Here, when you're talking about sarcopenia or muscle loss, it is not cardio. So, if you're just doing your yoga without the just the asanas, that may not help. So you have to know, even in yoga, you have some asanas where you're standing against your weight. So the muscle strengthening has to be there in any kind of exercise program that you have taken. So the best, of course, is the simple dumbbells that you do, or the bands that you do. You don't have to go to the gym every time. But first time when you're learning the muscle strengthening, it's best to do it under supervision.
Okay.
So I strongly believe if you're healthy, you're young, it doesn't matter. But if you're older, you have never done exercises and you want to start your exercises and you start doing your dumbbells at home, you may get into trouble. So you have to at least do a 1 month or 2 months under supervision, and then you can do it comfortably on your own.
Thank you. So
Because we are not going
we
to. Yeah, sorry. No, a lot of people think muscle strengthening, for your day-to-day quality of life, the amount of muscle strengthening exercises are very simple, very doable. So you can just do that much. So don't look into the YouTubes and the social media where they show those lovely muscles at 80s and 90s. It's different. The aims are different. So I think for a general population, The aim should be your quality of life. That means you should be able to move briskly. You should be able to do your own thing even at 80.
Yeah, that's true. Uh, and we have a couple questions with some of them are shared with me. Let me go through that.
Sure.
So, and also, doctor, like, how do we identify menopause specialists? So, usually here if we have any problems, we generally go to the gynecologist.
Yeah,
So
yeah,
are they
yeah.
gonna like, and also if we tell our symptoms and whatnot, they do like a blood test to see like whether
Right.
we are in the perimenopause or menopause stage. But our hormones are like fluctuate, right? Always. So how can we rely on those lab results to determine whether we are on that particular stage or not?
Yeah, so I strongly believe that hormones is not the way to diagnose diagnose menopause, not at all. Unless, like I said, three important things that you have to remember. If you're less than 45, less than 40, or if you're planning for a baby. Those are the time hormones are important. Otherwise, you don't need hormones to diagnose your menopause. Or you're thinking of the symptoms are not going away. You've looked into everything, but even then, that's always we always do a trial of medicine of hormone therapy. If we think just give 2 months of therapy and you know whether she's it's because of menopause or not. You don't have to do the blood test because blood tests are never predictable. They are not cost effective, and especially the salivary tests are useless. The compounded hormones are not to be taken, especially for you people because that's what is happening in US. And there also you don't have dedicated. Very few menopause specialists are there. It's all the general gynecologist. So you can actually go to the Menopause Society website, and I think they have a list of doctors who have passed their exam. The Menopause Society exam, they credentialated. So similarly, even in India, we have about 600 doctors who are menopause specialists all over India who have passed this exam.
Only
So
600, yeah.
yes, with a huge population
Huge
like this, I
population.
mean,
Yep.
we're talking about the specialist group. The
Okay.
general gynecologist will have an idea, and we do make a lot of noise about menopause everywhere now. Yeah, so people are better off than what it used to be earlier, but it's
Yes,
going to take time.
that's good to know. So, yeah, what lifestyle changes? I think you already mentioned like a diet and exercise will help. So, can help like, so
Yeah.
to
And I think most
sleep.
important is your mind, the self-help, the motivation.
Yeah. So,
That's the most
missing,
important thing.
yeah. So, missing cycle, sleep, mood, energy, and are these like weight gain? Are these normal during perimenopause, or is it symptoms that need to consider to be like other some
No,
other
they're
things,
normal,
hormonal changes?
especially the brain fog, starts at perimenopause and then it reaches its peak for next 1 or 2 years and then it goes off. It's very different from dementia. So if it is because of the estrogen, it goes off and you really don't have to do anything much unless it is associated with your vasomotor symptoms because your vasomotor symptoms and lack of sleep can precipitate it more. So it's simple logic and it's not science. Say if you have not slept well for days, your mind is not going to function well, isn't it? That's brain fog. You don't recall well. So if you're not comfortable throughout the day, you don't sleep well. So
Yes.
with the vasomotor symptoms, first thing is you react. What's happening to me? Why is this happening to me? That itself is enough to make your mind work.
That's good. And some of the questions regarding the bladder issues and urinary tract infections are most common that we hear during the menopause and perimenopause stage. So, when
Uh,
do we need to consider that?
Yeah, I don't think the urinary tract infections are so common in the perimenopause.
Okay.
Generally, it's just the vaginal dryness. So there we have to look for infections which are much more common at that stage. The vaginal infections,
Vaginal.
viral infections. The UTIs will happen about 4 to 5 years after menopause,
Okay.
which are related to the estrogen deficiency. So it's not at that time, I don't think so.
Okay. So, what treatments can help with dryness or discomfort?
Yeah, there are local vaginal, either you can use the moisturizers and the lubricants.
Okay.
You can, or the estrogen therapy as well. If it
Estrogen.
depends on, yeah, it depends on your presentation and your clinical examination that we do, no? So we take a call after that.
Few more questions. Yeah, I think most of them are like hot flashes. Wanted to know more about the hot flashes. I think it's a lot of them, like they wake up in the middle of the night during the hot flashes. And is there something that you recommend to ease the hot flashes?
Yeah. So I think if your hot flush is that bad, of course, lifestyle changes, it's all there on the social media where you know what to do, light clothing, don't take caffeine and all that, the
Yeah.
lifestyle changes that you need to do. But apart from that, I think these are the women who really benefit her hormone therapy. They are
Okay.
the ones who need the hormone therapy. So that the treatment, if it's bothering you, if it's you're making you, wake up at night, then you're going to get the brain fog because you're not
Oh,
slept the night. Then you cannot
sleeping.
function. Your
Yeah.
work productivity also comes down at home at your workplace. And then, it's a cycle, no? You get into depression, you become anxious. So to break that cycle, go for hormone therapy. Best.
Okay. Yeah, sleep is important. Hmm. to
Absolutely.
to be functional. Yeah. Yeah. So anyone have any other questions? You can
Yeah, Sangeeta,
unmute
I
and
think
ask.
we have one question.
Yeah.
So when
I
you
would like to see
say,
you also, Shailaja. That would be nice. That's nice.
yeah,
Hello.
so when you say the hormonal therapies, right? So you said menopause, a specialist would do a good job than a gynecologist, like.
Yeah, correct.
So, but how do we know actually, like, we need a hormonal therapy? Are there any non-hormonal therapies
Yeah,
available?
there are non-hormonal therapies, but like I said, if you're really suffering bad, if it's moderate to severe symptoms, there is no point in going for the non-hormonal therapies.
Mhm.
It's good to go for the hormones at that time. See, the non-hormonal therapies have come up in a big way post WHI when the hormones were the studies, like I told you in the beginning. So it
Mhm.
was stay in the analysis of the data from that particular study where everything changed. But now we know better. We know better that hormones are the ones which you need to take. So that was the time where all the non-hormonal therapies came up. But even the non-hormonal therapies, which especially for hot flashes and for your anxiety and depression, have their own huge set of problems. It's not easy. The other ones is your lifestyle, So all the lentils and your Bengal gram, the Indian food is very good. If you want, if it's only mild and moderate, the lifestyle will work. But if it is moderate and severe, that this is not going to work. But yes, in US you have the fezolinetant, which has just come in, and
Mhm.
that's a good non-hormonal therapy. That's a new drug which has come in, which is not estrogen and which is really not non-hormonal as well. So it is working at the brain level and the side effects are minimum. So I think that's a very promising drug for those who don't want to take hormone therapy for whatever reasons.
But how do we identify whether we need a
Yeah. I
therapy?
think you should go to your menopause site. So now earlier on, the society was called the North American Menopause Society. They have recently changed the name to the Menopause Society. So
Okay.
they've got some wonderful. It's a good website. And if you come to India, of course, you have the Indian Menopause Society, where the list of doctors anywhere in India you can. We have about 50, 60 chapters all over. And so you can reach any good menopause specialist listed out there.
Sure. Thank you. This is so helpful. Thanks for doing this.
Yeah.
Yeah.
So please don't go with the thought that the gynecologists don't know about hormone therapy.
Yeah, yeah.
I'm just fine nonsense, nuances may not be known to the general gynecologist because they're so much engrossed in the infertility or the IVF or the you're delivering babies. For them this is not as important to learn, no, to keep updated. So this is a specialty on its own. For simple cases where straightforward hormone therapy, any gynecologist probably can help you out. But people who have medical problems, those are the ones where I think you should be seeing a specialist.
Thank you.
Yeah, hi,
Right there.
doctor. Thank you for all the information. One quick question. Do you provide any online consultation, like video call or um, just over the phone?
Yeah, unfortunately, because I am very busy and this
Okay.
takes a lot of toll.
Okay.
So right now, I'm not into it, but I'll definitely let Sangeeta know if ever I start.
Sure. Thank you.
Yeah, yeah.
Hello,
Hello,
doctor.
doctor.
one
Yes, ma'am.
quick question. So, can we lower the joint pain and knee pain by the hormone replacement therapy?
No, not at all. That's why I said we are not going to label every disease because of hormones. But there are few studies which have said that people who are already suffering from osteoarthritis and you're
Mm-hmm.
going through the menopause, maybe the estrogen deficiency will accelerate it a little bit. But that's very little. And by adding hormones, your osteoarthritis is definitely not going to be relieved. The pain is not going to go away. The most important thing that you have to do is your dedicated your quadricep exercises
Mm-hmm.
and your range of motion. Two very important things for your knee. And of course, your weight. You can't
Okay.
have a heavy weight for your knee.
Okay. Because of the menopause, we start gaining weight, and it is because of all this, like you start getting knee pain and all.
No,
So,
no, no, no. No, 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 no. It's your lifestyle basically and your genes, which you have probably menopause, not more than 1 kg or 2 kgs, not more than that. The changeover is only that much, but probably because of the change in your mind, your lifestyle changes, or maybe your eating habits have changed. There is something more to it. You have to be very truthful to yourself. That's why I said it's all self-help.
I
And
am
accurate.
I'm doing the same kind of exercise I used to do before. Still, I
Correct.
am gaining a lot of weight.
Correct.
I
But you
don't.
have to look, the pain is the knee. So you have to have, the grades of osteoarthritis. It all depends where you are in. The grade one
Mhm.
and two can be actually conquered by your exercises. And the weight definitely at menopause more difficult. So you have to eat less, exercise more. There is a change.
Okay. Thank
You
you,
can't
doctor.
eat the same amount what you used to eat earlier. So you
Mm-hmm.
have to be very, very careful about your food habits during this transition phase.
Mm-hmm.
But
But
in that extra,
my gynecologist, he said to go with hormone replacement therapy for the joint pains and all. So, what would you suggest? Do I need to go or not?
yeah. So no, for you, without a proper consult, I cannot tell you whether you. I would never prescribe hormone therapy only for a joint pain. If it's only
Okay.
that, I should have
Okay.
some good reasons why I should be giving it to you. That's why I said general gynecologist and a menopause specialist work differently.
Because I'm already in menopause, and so he said that may help you.
Mhm. Yeah,
Yeah.
so that's the worry now. So there's now going to be an overdose of hormone therapy everywhere, and that's a real
Okay.
fear
Uh,
because you have to work on, the basics. That is your weight, your knee joint exercises. That's more important than hormone therapy. That's going to work.
okay.
Thank
Okay.
you, Harita.
Thank you,
So,
doctor.
considering the time, we'll take one last question and yeah. Ru- yeah, please go ahead, Ritika.
Yeah, hi doctor. Thanks
Hello.
for such needful information. So I have a question like overbleeding and like back pain or the symptoms for the menopause like after 40 plus.
Definitely, yeah, it can happen, but usually the periods get scantier, not heavier. But sometimes you still can have heavy periods for a few people. So it's always good to get yourself investigated because this is a time where the fibroids, adenomyosis, and endometrial hyperplasias, a lot of gynec problems also crop up after 40. So that needs to be ruled out before we say it's menopause.
Okay, so any diet like if we focus on diet and all that will help
No, no,
like
no,
this.
no, no. Yes, of course. Diet will help indirectly because if you're obese, your estrogen levels go higher and you bleed more. So that way it'll help. But then that's just that the diet is not going to help completely because that first you have to have a diagnosis. Without a diagnosis, we cannot treat. No, first you have to know why you're bleeding.
Okay, okay. Yeah, thank you.
So have a very, very good Saturday and a happy weekend for all of you. So it's been a pleasure to communicate with all of you. Thank you, Sangeeta.
Thank you, doctor. Thank you so much. I know it's late in India now. It's 11 p.m. for you, but thank you for being with us and sharing the amazing knowledge. It's
Bye
an
bye to all of you.
incredible. We
Yeah.
love it. We love this session. Thank you, doctor.
Bye.
Bye bye.